the doctor leaned over close to me and he said to me, I don't care where you're going or what you're doing. If you don't have a CAT scan today, you're not going anywhere. Hi, my name is Holly Brown. I'm the executive director and founder of a nonprofit called Looking and Feeling Fab. And I am here to talk about my own experience. I had a tumor on the roof of my mouth, and so I'm here to tell my story. I had woken up one day and found a little bump on the roof of my mouth and just kind of ignored it. I thought it would just kind of go away or fall off. A few days later, I had been talking with my husband. He said, "Oh, you sound like you're talking funny. What's going on?" And I opened my mouth and I showed him my upper palate, and he said to me, "That looks pretty serious. You should probably go to the doctors." So I made an appointment. I went to the doctors, and the doctor was like, "Wow, you have to be seen by a ear, nose, and throat doctor like yesterday." So we went into his office and he looked in my mouth and he said, "You have to have a CAT scan today." So then I kind of thought, oh God, this is serious. So I had been in touch with Steve from NeoGenesis because we had been working to prevent a lot of radiation, irritation and burning for some clients that I had been seeing. So I asked him, I said, "I know that the recovery has done such great things for our clients. Do you think, would you check with Dr. McGuire and see if I could use the recovery in my mouth?" Because, they're talking that I might need reconstructive surgery, and they didn't know how long it would take to heal and if there would be any further treatments or not. So he checked with Dr. McGuire, and Dr. McGuire said, yep, it would be fine to use in your mouth. So I went in, I had the surgery, and I had told the doctor about the NeoGenesis, and he said, "Oh, no, just let it heal, just let it heal." And so he said, "It'll probably take a couple of months, and then we'll reassess and see if we need to do reconstruction. We can talk about that, after it's on its way to healing." And so I made a follow-up appointment with him. They took a biopsy and sent it away. And so I went home and he sent a big giant bottle of pain medicine home. And I thought, oh, I really don't want to be taking that pain medicine. So I started right away to spray the recovery in my mouth. And I felt, wow, this is like great. I didn't really feel much pain or stinging or discomfort or anything. So every time I would start to feel a little bit of pain, I would spray the recovery again. And I just kept spraying it. And then maybe like 2 weeks later, I went back to the doctor and they told me the results were back. And my God, your palate is totally healed. And there's no crevice or any reason why we would need to do reconstructive surgery. And I said, yeah, that's because I've been using the stuff you told me not to use. So when I got home that day, I called Steve from NeoGenesis and I said, my God, Steve, you are not going to believe it, but I just saw the doctor and he's amazed at how the palate is healed. And to this day, I've had no more trouble with my palate and it's completely healed back to normal.